Allowing patients, though, to order urine and blood tests through the NHS app could avert the 8 a.m. scramble for GP appointments, so a think tank has reported. The report from the Policy Exchange, you'll hear from a representative in just a moment, says we must try to improve access to the GPs by revolutionising the first contact service. Talking of a new NHS gateway, it suggests patients could answer initial questions about their symptoms, then be given the option to order blood tests and kits at home, taking pressure off busy GP services. Robert Eade is head of Policy Exchange's Health and Social Care Unit and co-author of this report. It's entitled At Your Service, which looks at ways to improve the service offered by GPs. And joins me now. Mr. Eade, how much has the service that is offered to us by our GPs been impacted by COVID? Good morning.
Good morning, Nick. The impacts have been quite significant. I think many of your listeners will have struggled to get a GP appointment over the past 2 years, and it's quite a familiar routine. You call up the reception, you're put on hold for several minutes. The surgery might then say a doctor will get back to you at some point between 2 and 5 o'clock in the afternoon. But then if the call comes from an unknown number, if you miss it, you have to repeat the entire process. And we know that that is hugely frustrating for the public. GPs are working as hard as they can, but something needs to change, and that's what our report sets out to do.
Are there enough GPs? Because bear in mind, we are an ageing population. We're kept, thanks to the wonders of drugs, and indeed our doctors, we're kept alive longer. But there's probably not enough doctors to go round.
You're absolutely right. We do need more GPs, and our report talks about ensuring that we can hire GPs and thinking creatively as well. So, for example, looking at international qualified doctors who may be practicing the NHS and have decided to emigrate to places like Australia. Could they deliver remote care sessions to fill the capacity gap? But we also think that the current partnership model needs to be looked at. Fewer new trainees want to become partners. It's not attractive necessarily for them to run a business alongside the pressures of a very busy health service. So we're calling on the government to consider that again.
A number of my listeners in the past, Mr. Eade, and you'll be aware that other news events have rather overtaken the agenda for now, some of my listeners say they're still finding it difficult to get what are called face-to-face appointments with doctors post-COVID. Do you think it will take a while, but do you think that issue is being rectified?
We need to be guided by the evidence. We know that some patients really value a face-to-face appointment. Many will have complex needs, and arguably you could say that a 9-minute appointment in a busy surgery is not actually well suited to them. On the other hand, you've got other patients that value convenience and speed. They're happy to have a phone call because they've got a one-off issue that they want to see resolved. You should design and plan the services quite differently rather than trying to push everyone through the same 9-minute appointment process.
How do you know whether I benefit from a telephone appointment or actually a doctor in the flesh, face-to-face?
Well, Nick, that's when good data has to come in. And at the moment, there's no systematic reporting or collection of data within general practice. It's much worse than we have within hospitals. So we're calling for some of the best elements of hospital care to be mimicked in primary care. The NHS app can help with this as well. 23 million of us have it in our phones, and it's been really useful. It's given us access to things like going on holiday, to getting into nightclubs. We need to make that a really valuable resource for primary care too. So we could log your symptoms, Nick, so they would be able to understand what your condition was and give you the service to match.
But if, to use an expression, if I had, I don't know, a lump or a bump or a bruise or a mole somewhere where I shouldn't have one, that's not going to help me with my NHS app, is it?
Filling out some early questions can just mean that the GP can spend most of the time inspecting that lump or bump rather than having to use the first half of the consultation to understand your story. So it's about making the process more efficient, both for the consumer and for the producer, the GP who's trying to provide care.
Lastly, is there a danger? I hear what you say, and hopefully I'd be up to speed to do that, but isn't there a danger that perhaps the elderly and the vulnerable are the most likely to be left behind by these changes?
It is, but 96% of us have internet access in the UK. We need to make sure that we provide services for those who are digitally excluded, but we need to learn from examples like internet banking. Internet banking has become commonplace, but you can still do your banking at the post office. So we need to retain that mixed method of approach.
Robert Eade is head of Policy Exchange's Health and Social Care Unit, co-authored the report At Your Service, looking at GP practices.